Hi there, I am a teacher and I am wanting to talk to you about all that's going on with the coronavirus, also known as the COVID-19. I'm guessing they're saying COVID or COVID-19. I just want to let some parents and people know, viewers, understand that we're still in school, but North Carolina has declared a state of emergency. So I'm just going to talk to you a little bit about the whole sphere of the coronavirus, or at least the parts that we have been informed on and the research that I've done myself on it. I see about 129 students and I see them on rotation. So we have an A-day, B-day schedule. So that means that I come in contact with approximately 129 students 3 or 4 times a week. Again, North Carolina has declared a state of emergency. Do not send your kids to school if they are sick. I know it might seem like a little cough, it might seem like a little sneeze. The symptoms as of now are coughing, a fever, and shortness of breath. So pay attention to your child and make sure that they do not have these symptoms, because they want us to start this whole term of social distancing, which is defined in the terms of the CDC as close contact, and that is defined as being within approximately 6 feet of someone. And as you know, school settings are close contact. You can't walk down the hallway being 6 feet from each other. So it is best, if you know that your child is sick, or if your child brings up that they are sick, to check and do not send them to school. You need to separate yourself from other family members and even your animals if you are sick. So think of giving someone your animal to watch if you do become sick with coronavirus. Those that are at a higher risk for the coronavirus are older adults and those with serious chronic medical conditions such as heart disease, lung disease, and diabetes. Personal equipment, like the whole gear, is not really recommended at the time. Again, these notifications are kind of coming in constantly, so we're learning as we go. But as of right now, the personal equipment, the protective equipment, is not recommended. But hey, do you? And the only 2 people that are kind of set to wear these are COVID patients and of course healthcare providers. So they're all recommended to wear face masks. Again, if you do get sick, you're recommended to wear a face mask. Some preventative actions are frequent hand washing. You should wash your hands for 20 seconds minimum. So go back to singing that whole ABCD song. With soap and water. Wash with soap and water. So I always say a quarter. If you put a quarter in your palm, it's the amount of soap that should be right there, because that's enough to full on lather. And again, you're not just lathering here. This is not how you're just washing your hands. You need to get the back of your hands, your wrists if possible. I go even as far as, because I have real natural nails, that I get underneath my nails and I get around my cuticles and get in here and here and here, and I do the whole shebang, and then you rinse off. The water can be warm or cold, okay? It's the soap. Whenever you cough, cover it there, okay? And you want to make sure that your whole mouth is fitting right in here, okay? So we don't want where it's like there, or where it's over top. You want it right in there so that it is not spewing over the top of the bottom. Again, stay home if you are sick, okay? Stay home. Having hand sanitizer that contains at least 60% of alcohol. So I am a dance teacher, so that means that my kids are always in constant contact with the same surfaces all the time. So I have Germ-X, and do not pay attention to this about it kills 99.99% of germs. No, you need to look on the back and it'll say alcohol 63%. And then I also have Purell. Again, on the front it says kills more than 99.9% of germs. And on the back it'll say alcohol 70%. So you want to check to make sure that your Germ-X contains at least 60% of alcohol. Avoid touching your eyes, your nose, your mouth. It says before washing your hands or with unwashed hands, but I recommend not touching those areas at all, because you shouldn't want to. You touch doors, you touch your phone, which lays on surfaces that you then pick up, put to your face. So you have to really start thinking about all the ways that germs are being spread. Social distancing is that term that we said again. So keeping 6 feet between you and other people. Of course, the more places that you travel to that are public, the less you are able to actually social distance yourself. And also clean and disinfect. Always coming in with contact with surfaces that my students touch, but I always keep some Clorox disinfectant wipes. And again, it's always the kills 99.9%. And I'm gonna have to look a little bit more into this. There's currently no vaccine. Virus spreads person to person. The first outbreak started in Wuhan, China. As of right now, there are 938 cases and 29 deaths in the United States. 92 of those are travel related. 75 of those are close contact, and 771 of those are under investigation at the moment. Make sure that if you do get sick that you have the supplies needed to quarantine yourself. So I would go ahead now and go stockpile on food, which you should technically have anyway. A lot of water, jugs of water, stuff that you need. Maybe I'll do another video of good supplies that you could use if you need to quarantine yourself. And as of right now, the places with the highest reported cases are New York, California, and Washington. So just don't freak out. We're figuring this out. Sanitation should always be key, but I guess sometimes in the midst of life that we kind of overlook all the germs and stuff. We get sick and we take care of it and then we move on. So just relax. We don't want to be those people that are not concerned, but we don't want to be those extremists. We want to be here in the middle where the logic is and where the information is. And TV and press can sometimes scare you, so I really want you to be aware of how that is affecting your own mental health. We don't want to add on stress, and we don't want to scare other people. So as a teacher, a lot of kids come in here crying, they're scared. And it is my job to give them the facts. And so I want to share this video with you, and if you would like to share it with other people, if you want to get in the comment section and tell me what other videos I should share to make this a lot easier, I can do that, and I'll keep all of my videos 10 minutes or less because I know we have life to live. So thanks for watching. Be safe out here, be sanitary out here, and you'll be okay. Bye.